Institute in Los Angeles, California. So we are so excited to talk to you guys today. And the first thing we want to say thank you so much for all of you that tuned in this past week to kind of hear all the positive things we have to say about exercise. As you can tell, we're super passionate about exercise because we know all of the benefits that it has, especially for individuals who have Parkinson's disease. So I'm sure that you've realized a lot and kind of learned a lot about what we are talking about. But go ahead and we're going to do a short little recap about what we have learned. So the first thing is that we heard from Dr. Erin Cottle about the importance of sleep and how it's critical in maintaining your brain health. You want to make sure that all of the restoration and all of that rejuvenation that you get during sleep, you get all those benefits. So making sure you take those good sleep habits. We also learned from Chelsea Duncan, Dr. Chelsea Duncan, about the benefits of exercise in preventing constipation and really making sure that your digestive system stays healthy. We learned that exercise actually gives you energy, which is really kind of counterintuitive to some of us. Sometimes you think, oh, I can't exercise because I don't have the energy. But in reality, you need to exercise because otherwise you're not going to get your energy. Finally, we learned from Dr. Julie Hirschberg about that exercise really helps you to think more clearly. It increases blood flow into your brain, and that's kind of our primary means of inducing these neuroplastic changes. And those are all really helpful when we're trying to do neuroplasticity. We're trying to get positive brain health, positive brain changes through our exercise. So we really encourage all of our patients to really think about exercise as medicine. When we kind of introduce that idea, some people are like, oh, well, exercise isn't really medicine, but it really should be thought about like that. It really does have the benefits and does not have the kind of side effects that many of us get from some of the medications we're taking. So, but in that sense, you wouldn't skip your medication, every other day or so. You'd make sure you do your daily dose of medication, of exercise. So underlying the reason that exercise can be thought of kind of like a routine that you go through, not that you at all use exercise to replace it, but it's just a thought process of doing exercise on a daily basis to improve your health. We know that this is actually driven from the thought process of neuroplasticity. So neuroplasticity is actually the key underlying mechanism that gives us those positive brain changes, positive health, all of those things that are going on in our brain with exercise. It includes a wide spectrum of benefits. It includes things like synaptogenesis, neurogenesis, neural sprouting. All of this goes on with increased blood flow and positive blood flow to the brain. So there's a lot of really great research that proves that exercise is what facilitates this process from happening, and we are really excited to share all of those benefits with you and hopefully get you as excited about exercise as we are. So here we're going to hear from Dr. Lauren Caldron.
Hi, good morning. My name is Dr. Lauren Caldron. We're just moving closer to the screen now so that you can see the figure that I'm going to be talking about in just a second. So today I'm going to be talking about goal-based practice and how that can drive neuroplasticity and help you improve your function and independence in your daily life. So we're going to first start off by talking about what actually happens in the brain when we're doing goal-based practice so that you can see what's going on. So I love the picture behind me because it helps to explain how exercise can affect the brain and our overall function in people with Parkinson's disease. Overall, this is summarizing that clinical and basic science research support the effects of exercise on neuroplasticity in Parkinson's disease. So I'm going to be talking about goal-directed exercise, and Chelsea, who's talking after me, is going to be speaking about aerobic exercise. So you'll see this figure 2 times. So let's start at the top. The very first thing on the top of this figure is exercise, both goal-directed exercise as well as aerobic exercise up there. So both goal-directed and aerobic exercise may strengthen and improve motor circuitry through mechanisms that include but are not limited to alterations in dopamine and glutamate neurotransmission, as you can see up here, structural modifications of the synapses, which are those connections between our nerve cells that helps relay that communication from the brain down to the rest of our body, and the reversal of dendritic spine loss, which can also help with that communication. In addition, exercise may promote neuroprotection of the substantia nigra neurons and their existing connections. While more studies are definitely needed, we can take this information and these research findings that they're supportive of a disease-modifying effect of exercise in Parkinson's disease. So what is this goal-directed motor skill training? Goal-based practice designed to help you acquire a skill, whether it's related to your walking, your dynamic balance, your arm function, and it's practice that includes repetition, intensity, and challenge. We're going to switch to the next slide so you can see this. So it's done in a supervised environment to facilitate learning through feedback provided to you by your PT. Sorry, it's a little hard to see the slide right now. The potentially important role for feedback includes challenging you beyond your self-selected levels of perceived capability, motivation, and to facilitate the engagement of your cognitive capabilities and help you become more cognitively engaged in what you're doing, and this can help drive that automaticity of movement. And another key feature that I want to talk about in terms of motor skill training is context specificity. It's really important to be training all these different skills, whether they're your balance or your walking, in different contexts and different environments. So training inside, outside, on grass, over sand, anything that's important to you to help you improve your function. Thank you so much for listening in, and I'm going to pass the mic over to Chelsea.
Hey everyone, how is it going? Thanks again for joining us for this Facebook Live. So I know we have the screen behind us, but if you can't read it right now, I know I was looking at the Facebook Live on my phone. We're going to post some of these really cool figures on our Facebook so that you can kind of take a look at it a little bit more clearly. But kind of piggybacking on what Lauren said, I'm actually going to be talking about aerobic exercise. So I don't know if you can see it above my head. It says aerobic training. So if you don't know what aerobic exercise is actually when you get your heart rate up a little bit. So you're working out at a little bit higher intensity, and it's really, really important for everyone to be getting aerobic exercise as part of their normal exercise kind of regimen routine. So the reason is that aerobic exercise increases blood flow to the brain and to all of our muscles in all of our body. But the importance that we're kind of talking about in people with Parkinson's is the brain changes. So this increased blood flow to the brain actually primes the whole brain for setting it up for neuroplastic changes. So that idea that we're getting some changes to the brain, but you kind of need that increased blood flow in order to kind of set it up for success. So that's the first really good thing about aerobic exercise. The second thing is that you get increases in these trophic factors, and you can kind of see on my screen, I don't know if it's kind of hard to see up there, trophic factors, but one of those is called BDNF, which is brain-derived neurotrophic factor, and that actually, thanks Dr. Cottle, that actually helps with increasing hippocampal volume, and I know, big words here, but just bear with me. The hippocampus actually is important in consolidating short-term memories to long-term memories. So as we get older, memory can be something that a lot of us think about, and a lot of our clients, say, I want to improve my memory. And aerobic exercise can increase hippocampal volume, which helps with that consolidation of short-term memories into long-term memory, which is really cool. We're trying to figure out our lighting here, so if you can see me, you can like this video. Anyway, hopefully I'm not too dark here. Brittany, thanks for liking. Okay, so moving on, some other things that happen with aerobic exercise are increased corticomotor excitability, which basically is all those connections in your brain, the existing connections that are really working hard, get strengthened, which is really cool. And even those areas of your brain that are affected by Parkinson's disease, the basal ganglia pathways, are actually strengthened with aerobic exercise. So this is really, really exciting. Let's talk about some of the research. Research shows that higher cardiovascular fitness has been shown in cross-sectional and interventional studies to be related to better cognitive function in older adults. So it may not be the only part of the picture. It actually is pretty clear that it's not the whole picture. You need this like skill-based training in addition to aerobic exercise to get brain change, but it's a really important part. Thanks, Bianca and Terry, for joining and for those awesome comments. We love them. But let's go to the next slide and kind of talk about what intensity you should be working at. You'll see behind me, and it may be a little hard to see, but this is called the Rating of Perceived Exertion Scale. So it works on a scale of 1 to 10. And 1 means that you're kind of rest. You're not exerting any real energy. You feel kind of completely at rest. 10 is the maximum exertion, and you really couldn't do anything else. So we actually want to work on this scale for our aerobic exercise, and it's recommended that you get 30 to 60 minutes a day in this first kind of circle. Where Dr. Cottle's kind of pointing this, like 4 to 6 is really ideal for getting moderate intensity aerobic exercise every day for 30 to 60 minutes. But then in addition to that, you want to try and actually reach up to that 9, 10.
Actually, it's supposed to be 7, 8. It got shifted.
Oh, 7, 8. But you can get up to those higher intensities throughout the week, trying to work up to a couple times a week up to 40 minutes. And that higher intensity in people with Parkinson's has actually been shown to give the most dopaminergic effect, the most brain change. So working out at a higher intensity than you would normally choose is actually really good for the brain. So I hope you enjoyed this little section on aerobic exercise. If you have any questions, feel free to comment, and we can kind of discuss further and really reach out to your physical therapist who can help you design an aerobic exercise program that's appropriate for you and one that's safe for your heart so that you can do it really well and get the most benefit out of it. So I'm going to turn it over to Dr. Erin Cottle to kind of finish it up.
Hi, everyone. Thanks for joining us on a Saturday morning. We're really excited that you could be here. And we have some really fun exercises that we're going to do after our educational things. So I'm just going to kind of wrap it up with like, what are sort of the take-home messages about exercise, what you should be looking for, what do you want to be doing with your exercise program. So maybe I can kind of stand here. I don't know if you can see that very much in the background, but just the practical aspects of your exercise, like goal is to get neuroplasticity. Like that's for anyone, people with Parkinson's, people without Parkinson's, but we want brain change. That's why we're putting on all this effort. So what can we do to get our brains to be as healthy as possible, which is going to help our body be as healthy as possible. So you want to get at least 30 to 60 minutes of exercise every day if you can. So even if that's just little things here and there that add up, like do it. Just try to get out there and move and build up your exercise tolerance. You want to do this at least 2 to 3 times a week. I know I just said every day, but yeah, a girl can dream. So at least 2 to 3 times a week, but working up as much as you can to get into a more strengthening routine and build up your endurance, build up your tolerance. You want to have different components of exercise. So that's what the other doctors here were talking about. You want aerobic exercise, but you also want resistance training and skill training. All of these do something different for the brain that help it in other ways. So make sure you get all of those components into your exercise program. Okay, so it's going to help all those things that everyone just talked about. So on the next one, we're going to talk about like questions about your exercise, like what kinds of things do you want to ask about your exercise program to know if you're getting the most out of it? So are you acquiring a skill? Are you doing something that takes skill, that takes effort, that you're learning about? This is super important. You want to be sure that you're asking that. Are you challenging yourself enough? Are you working hard? Hi, Paul. Oh my gosh, it's so good to see you out there. Is someone analyzing how you're performing or providing you feedback? You need to get that in order to learn. You have to have somebody, especially when you have Parkinson's, it can be even more helpful to have someone point things out, because maybe you didn't know you were moving as slowly as you were. Maybe you didn't know you were talking as low as you were. Those are things that people often feel. So make sure you have someone giving you some input. Are you becoming aware of your movement? That's where the feedback comes in. Someone's helping you learn, and then you're starting to become aware so you can change your movement yourself. Are you being progressed continuously? You don't want to do the same thing over and over again. You're not going to adapt and learn. The brain needs change and challenge and new input. So make sure you're being progressed and you're doing something different, something that challenges you every day. You can progress yourself as well. If you're walking in a walking program, make sure you add like another minute. Maybe add a different place that you go to walk, something that's a little bit more challenging to walk on instead of just concrete. Something like that, but make sure you're progressing. The other thing that's super important is fun. It needs to be fun. You need to have a good time while you're doing it. You want this to be a lifelong habit. You don't want it to be a chore, something you don't really want to do. You want to have a good time. Like, that's what we're all about, actually. If you've been to any of our classes, you know we like to have fun. We like to laugh. It's good for the brain. It's good for the immune system. So make sure you're doing something that you really enjoy. And change the environment. So that's what I said before about progressing. Like, that's another thing you can do, is change up where you do things, get a new environment, a new perspective, a new context. And then, are you motivated to do the exercise on your own? Or would it be better if you had a professional help you? It doesn't matter. It's up to you. Whatever gets you to do it is the most important thing. So if you need someone to help you, you can find a health professional. You can find a neurologic physical therapist. We have a bunch of people that we know in our Southern California area, but there's also people all around the world that can help you. So no matter where you are, you can find someone that can help you exercise. So I hope you enjoyed our educational points today and are really excited about exercising, because we're going to go into some exercise now. Yay! So let's get our people set up. We're going to have a little live exercise class with you all.